Hello and welcome to Alka's Aging Life Care Moment. In 1985, the Aging Life Care Association was founded by a handful of intrepid women. However, since those early days, the number of male geriatric care managers has been increasing. As part of the Aging Life Care Association's efforts around diversity and inclusion, and during the month of June, as part of Men's Health Awareness Month, we will feature male members to hear how they got started in this career and how we can bring more gender diversity and awareness to aging life care practice. Today, we are talking with Byron Cordes, president of Sage Care Management, the 2020 recipient of the ALCA Adele Elkind Award, and the NACCM board president. So welcome, Byron, and tell us, how did you get started? How long have you been practicing care management?
Sure, and thanks for asking me to do this. So I started as an aging life care manager in 2002. I had been working, I'm a clinical social worker, so I had been working in private practice in mental health. I had been working in a medical setting, in a healthcare setting, and was a director of case management for about 8 years in a large hospital system. And what I recognized was that there were lots of people who could guide you through a crisis when you were inpatient, but once you went home, there was very little that we could do to kind of help put all the pieces together. Everything was fragmented. So I thought I invented care management. I think a lot of people think that when they first have the thought. So as I did research into what I thought, I wanted our practice to look like, I found out there was already an association with guidelines and people and experience. Having started my company really in 2002, I joined the Aging Life Care Association in 2003.
Yeah, that's a great segue into the next question in terms of how long you've been a member of ALCA, and tell us a little bit about your journey within the association, leading you to different positions and leadership roles.
Sure. I think if anybody's involved in the Aging Life Care Association, they understand what just an incredible group of people it really is. So it's pretty easy to want to be around them a little bit more. We don't have a lot of people that do what we do in our area. So you really have to kind of find your tribe. And so quickly, once I joined, I tried to become active in both our local chapter and in the national. I think I was our chapter president within the first 2 or 3 years of joining Aging Life Care Association, and then quickly joined the board for the National Association. And I think a lot of that was to give back. I think to try to help form this profession, or to keep this profession. I'm not even sure what to say, but just to help make sure that it's molded in the image that I think we all want it to be, since this really is the one professional organization for this career path. But I quickly found out that there were some selfish reasons too, that I got a lot out of it. I made a ton of friends. I was able to grow my business by finding out some best practices when I worked with other care managers. But I also got referrals because I met care managers from across the country. And so, if someone in Des Moines, Iowa is looking for a care manager in my area, hopefully we've met at a conference or on a board or on a committee. So, so there are some selfish reasons too. I hope that's not how it started, but it certainly didn't hurt.
Thank you. And tell us, among your experiences, within ALCA, but also within the industry, I'm sure you're familiar with being around a lot of other women aging life care managers. Tell us how we can bring more awareness to this career for other men who might be practicing this.
Yeah, I think, and certainly as I've been a social worker for over 30 years. certainly in social work, in the healthcare and ancillary healthcare, nursing, social work, gerontology, and even in psychology a little bit. It draws a lot more women than it does men, for a variety of reasons, and we could get into those. But I think what we need to do is help men recognize that this is a rewarding field, and that, for lack of a better word, you can make money at it. You can make a living, and I think historically, some of the women in social work, this is going to sound so sexist, and I don't mean it to, but have gotten into this when their husbands could support the family, and this was a risky affair to get into because there were no people doing this. But I think our industry has grown. I think we're recognizable now. I think, over the last 35 years that it's been around, and I would love to see more men get into it. And I think we need to get out there and let males know that social work and nursing as professions, whether you're in geriatrics or not, is a rewarding profession. But that also there is this career path. So I'm not sure how to do that. If you know a way, let me know. But I think talking, educating. I know I taught college for 10 years, and pushed geriatrics a lot. So hopefully we can get more men, just more people. More men would be good too.
Yeah, absolutely. Thank you for that. And I think we're on that up curve, to opening up and having more people just in general see this as a really interesting career option. So
Yeah.
Byron, thank you so much for your time today. We really appreciate it.
You bet.
And
Thank you.
thank you again.
Thanks a lot.